Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hello, my name's Sharon. I'm an occupational therapist and I work in the Learning Disability team in Great Yarmouth.
Now, Sharon, you're here today to talk about migraines. Many people think that migraines are just nasty headaches, but actually they are extremely painful events, and they're often accompanied, as I understand it, by nausea, blurred vision, ultrasensitivity to smells, light and sounds as well. So these can be really debilitating and obviously, I presume, highly disruptive. So Sharon, tell us about your experience of migraines throughout your life.
So I started getting migraines around the time of puberty, which can be common for women with the change in hormones. And how mine presents is I'll usually start feeling incredibly tired, sick. The colour will drain from my face. And then I'll start with mine actually is in I get a pain in my cheek and around my eye rather than my head. It's always one-sided and it's a throbbing pain that you just cannot get away from. Sometimes I'll experience sickness. That's less so since I lost my sense of smell about 8 years ago. Prior to that, I would be very sensitive to smells. Food smells would make me feel really sick. But since my sense of smell has gone, I rarely have the sickness, which is a good thing.
Why did you lose your sense of smell?
I don't quite know. It was before COVID was invented, so it wasn't that. So it gradually disappeared, and that did prompt some concerns from a neurologist that I was under the care of at the time, because that combined with the migraines could have told a very different story. But luckily, there was nothing else going on neurologically at that time. It is just an unexplained anosmia, is the technical term.
You said you were under the care of a neurologist. Is that for the migraines that you went to see somebody?
That's right. Yeah, I'd been unsuccessfully through my GP, been given various medications that didn't really help. Nothing would prevent the migraines. So I had treatment to take for when it started, but I was keen to get to a place because they were so frequent and it was resulting in quite a bit of time off work that I wanted to explore other treatments. And that was why I was referred to a neurologist.
When they come on, do you get any kind of warning apart from the pain in your cheek, obviously? Do you and do you have to then sort of act fast to take something?
Yeah, I'll often crave something sweet, and I think a lot of people hear of sort of trigger foods and drinks for migraines. The experts are now saying that perhaps it isn't a trigger that by eating chocolate is going to give you a migraine. It's that actually it could be a blood sugar issue, that your blood sugar's dropped and you're craving something sweet. So I'll often crave breakfast cereal that I don't really eat the rest of the time. I will usually start to feel tired before the pain will start, and I'll yawn a lot. That's the other thing that I've noticed. And then as soon as I feel the pain start, then that's when I take a combination of prescribed and over-the-counter medication, along with full sugar cola. I was advised by a migraine specialist to take that to help get the medication into your system quicker. But time is of the essence. If you leave it slightly too long, then I've found the medication doesn't work, and that's when you might be in for several hours of pain.
So talk us through that then. What's the worst case scenario if you don't treat it quickly? What happens?
Any kind of movement makes the pain worse. The pain is unremitting, but if you can get yourself to bed, is usually what I have to do. Dark room, sensitive to the light, and moving around just makes it feel like there's somebody in your head with a hammer. But yeah, it's difficult, obviously, with work. There have been times where I've been able to take myself off to a quiet room, take my medication, and just try and relax to see if that gives it time to kick in. It's helped with more hybrid working, but you do have to act quick with the medication or it is fairly ineffective.
How long could you be out for then if it did strike?
It's generally, I would say now, around about 6 hours. And what can sometimes happen is it will go off, you'll feel okay in the evening, and then it'll start again in the middle of the night. So I don't very often have episodes now that last more than a day. But what I sometimes get is I'll have an attack one day, that'll then resolve, and then it will be back again. Usually early hours of the morning, actually. So, and by then it's established, and the medication isn't always effective because you're well into the attack by then. I had a consultation. It was during the first wave of COVID, actually, with the National Migraine Centre in London, which is a charity that offers appointments with migraine specialists. And their observation was that I wasn't treating the attacks as quickly as I should. And certainly since I've had the advice from them, I was always slightly scared because it's quite high doses of medication to take them all in one go. But since I've been more proactive with that, generally the attacks are shorter.
So prior to getting the medication, you obviously you've had these your whole life, like you say, from puberty. So there must have been times when this has really knocked out your whole day, or
Yeah,
and you've had to change plans at the drop of a hat and things like
yeah.
that. How does it affect your sort of personal life, or how did it, when it was at its height?
I think there's always been a link for me with my menstrual cycle. So that in some ways was useful because you could kind of preempt when you were likely to get one. But yeah, it does result in having to cancel things at the last minute, missing time off work. Very difficult. I feel I'm on a good regime now. But prior to that, you do feel quite despairing because you think, you're having to deal with this pain, awful pain, and limiting on your social activities, but then you're also worried about work and how that might be perceived, and people, oh, have you got one of your heads, and all that goes along with that. So, and it does lead to increased short-term sickness absence. So you're always worried. You've always got that worry in the back of your mind. And also you're worried about if you get unwell with anything else when you have got a chronic condition such as this.
Well, let's talk about that perception, because is what you suffer from classed as a long-term health condition in the same way as something that we might recognize as a bit more obvious, perhaps?
It's a chronic neurological condition. It isn't just a headache. And at this point, there is no known cure for this. There are different treatments, but as with anything, treatments carry risks of side effects. And some of the things I've been on previously to try and prevent the attacks in the first place have caused so many side effects that actually that's had more of an impact than the actual migraine attack itself. So it's trial and error, and one of the biggest positives I found was a consultation with the National Migraine Centre. I really would recommend anybody who has migraine to book an appointment with them. They are experts. You have a very extensive consultation, and they were able to provide lots and lots of advice that previously had never been highlighted via a GP or neurologist. And I think it just gives you that time to really say how it's affecting you, and they were able to come up with lots of suggestions to help me manage it better. It was really empowering. So they're
I
definitely
bet.
worth a conversation if people are struggling with managing their migraines.
Do you ever worry that it is something more sinister? And are you looked after in that way, that you do, do you have frequent tests to make sure that it isn't something that, something more neurological going on up there?
Not now. As I say, when my sense of smell began to deteriorate, there was a concern that possibly there was some kind of brain tumour, which then did result in brain scans. But routinely, you don't have any additional scans or tests for migraine. And I do think it you can be fobbed off a lot by your GP. You have your a 7-minute appointment, is it, with the GP? If you get a prescription, great. You don't really get a lot else in terms of kind of lifestyle advice, or obviously if your symptoms change, and mine did, which was why I sought more medical advice because I'd also developed the loss of sense of smell, then they did action that. But otherwise, yeah, there hasn't been any further follow up.
And do you get a lot of support through work?
Absolutely, my manager's really supportive. Colleagues are very supportive. There has been times where I've had to get people to take me home because I've not been able to drive. That thankfully is very rare. But yeah, work have been very supportive over managing this.
What would you say to anyone who might be thinking, oh, I suffer from really bad headaches. I wonder if it could be migraines.
I think if people are having symptoms, I mean, the general advice for any kind of headaches and frequent headaches is to contact your GP. Obviously, do all the normal things as well. Make sure I wear glasses, so I make sure I get my eyes tested regularly, just to make sure there's nothing untoward there. But contact your GP. And what I found helpful was keeping a diary. There's lots of apps that you can put on your phone for tracking symptoms, and some people's migraines don't present in the usual way. Some, and particularly younger people, can get a thing called abdominal migraine, where their pain is actually in their stomach rather than their head. There's lots of weird and wonderful symptoms in the world of migraine. So get a tracker, and that, I think, again, is useful to present that information to your GP or practice nurse if you're going for a consultation about the patterns. And certainly mine fell in a very definite pattern, which has meant they've been able to tweak when I have certain medications. And also, for me, being a woman of a certain age, hormones have played a massive part, and certainly the start of perimenopause had led to a real increase in migraine attack frequency, which I believe is quite common. And the good old HRT has really helped with that. I think just leveling out the hormones in your body.
Yeah, they do say that they usually begin in early adulthood, and more women than men tend to experience them because of the hormone level changes. So
Yeah,
yeah, that's something that we have to cope with. Um,
absolutely.
so what would you say to anybody who doesn't really understand what a migraine is and just thinks it's a bad headache?
It's difficult, isn't it? Because unless people have experienced it, and I have members of my own family that don't really understand it, um, but it is a neurological condition. It isn't all in the mind. It isn't just a bad headache. And, taking a couple of paracetamol won't shift it. The medication is quite heavy duty that you get prescribed as migraine relievers, and you do have to be careful with it. And it's just think about how you would feel if you were in agonizing pain and nothing would relieve it, and you were like that for several hours. It's really tough. And because we all have busy lives, stress is a big factor, or can be, in migraine attacks. You have to try and manage all of the risks that make it more likely that you're going to have an attack. And that's where there's no one size fits all with this condition. It's about doing everything possible to try and reduce the likelihood of one starting. So it's all the things that I suppose are for our good health anyway: keeping hydrated, eating regular balanced meals, getting some exercise, getting enough sleep, managing your stress. We all now do a lot of work on screens. So I always make sure I take plenty of breaks when I'm on the screen for a long time, making sure I've got my desk set up properly so that you've got good posture. So it's about trying to manage every single one of those little things to try and reduce the likelihood of getting an attack.
And do you have to manage things like holidays? And just thinking, if you're away in, I don't know, Spain, and you're relaxing by the pool, but it's bright sunshine and you suddenly get an attack, you've got to go back to your hotel room, close the curtains, and that's a day of your holiday gone. Do you have to sort of really factor that into your life?
Yeah, and weather can be a big one actually. For a lot of people, I always find, particularly if there's a thunderstorm coming, that very heavy feeling weather can bring on an attack for me. So you always have to have your medication wherever you go. So it's making sure you've got that. And again, holidays can be a real trigger for people. I don't know whether it's because suddenly you're relaxing, you might have a stressful lead up to that trip or whatever. We all have that mad panic trying to get everything finished at work before we go on annual leave. And then you suddenly relax, and that is when it can kick in for a lot of people. So again, it's just trying to really look after yourself and stick to as normal schedule as possible. So I always try and get up at the same time every day, go to bed about the same time every day, regardless whether I'm at work or on holiday. And yeah, so you have to try and plan as much as possible, but without letting it dominate your life.
Yeah, that's it, isn't it? I mean, you don't want to have to be defined by it. You want to be able to live your life how you want to, but at the same time, if you don't do those things, you're almost setting yourself up to fail when it does happen, I suppose. So
Yeah.
it's do you feel constrained, or do you feel like, well, this is just something I have to do to be able to live normally?
I feel better about it now. I think I feel more in control of it, and now I understand it more, and certain things are routine that I feel better about. When it was at its worst several years ago, you do feel very out of control because you just don't know what to do, and you just keep getting this dreadful attack. But certainly now I've taken steps and followed advice from experts. I do definitely feel more in control of it, and as a result I have less, so it's less of a problem.
You definitely don't hear it talked about very much, do you? I mean, do
No.
you have like a support network of other people who suffer from this?
No, not particularly. I do follow a few forums on Facebook, and the National Migraine Centre, who I've had a consultation with, they have a series of podcasts as well that are really useful on different, because there's so many different types of migraine. Um, and so I get a lot of my information from there. But yeah, there's not kind of informal support network, I suppose. It's just been things I've sought out myself, and I long for the day when somebody says we found a cure for this, but it does seem so multifactorial. There can be genetic elements to it, although there's nobody in my immediate family who suffers from migraines. Lots and lots of factors. And as you said, it is more common in women than men. I definitely think the hormonal element to the condition is a real factor. And hopefully, now that there's certainly more awareness around women's health issues in the workplace, that this would also be something that would be more recognised.
Absolutely. And I think it's important that workplaces consider this because, like you say, there will be sickness absence. There will be times when it is quite short notice. Like you say, you might have to
Mm,
just down tools and go home.
yep.
Have they told you what it is that causes yours then?
No, other than there's a definite hormonal link to it in terms of when I get my attacks. They're incredibly predictable. Um, but the way they described it to me is if you think about a computer and you've got your hardware, you've got your monitor, you've got your tower, you've got your screen, that the hardware in my brain is all working correctly. It's a software issue, basically, where neurotransmitters get a bit overexcited and flood the brain, and then that causes changes in the blood vessels in the brain, which is what causes the pain and the light sensitivity. But they don't know why this happens and why it happens in some people and not others.
And isn't that bonkers that after all these years of having it, that you're sort of still no further forward with the research? Do you think it's because there's no money in migraine research? Is it something that is being looked into enough, do you think?
Well, I mean, it affects a massive amount of people. I guess some of the difficulties might be in terms of some people can't predict when they're definitely going to get an attack. So, in terms of if you were scanning people's brains during an attack, because it comes and goes, but also it's some conditions attract more funding than others, because they have more of, I guess, more of a perceived impact. I don't know, but they do keep coming up with new treatments, and there's lots and lots and lots of preventative treatments for people who have a very high level of migraine attacks per month. Thankfully I don't fit into that bracket, but they're the nice guidance that you got to hit certain criteria before. There's things like Botox that some people find helpful, where it's perhaps tension in the neck and the head muscles that's causing the changes. And there is some newer drugs that are having really good results for people, again, who are having perhaps more migraine days than not in a month. So, but some of the older style medications, the side effects are brutal. So they certainly left me feeling more unwell than before I started. So I just couldn't continue with them.
It's a real journey, isn't it, to working out how to get yourself to a point where you can just live a normal life. It's not as simple as
Yeah,
just here's your medication, off you go. You've got to
no,
find the right one for you. Like you say, it affects everybody so differently.
definitely. And it has, it's taken me a lot of years to find things that help. Education is the real key to managing your own health. And say it's not gone away, but certainly they're less prominent than they were in my younger years.
thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.